Okay, just as you have seen grossly that this teratoma has both connective tissue, like tooth, as well as epithelial, like hair, elements, let's look at it microscopically. In this section here, I think you could see things which look like glands, perhaps mucinous glands or some type of gland. And up here you could recognize this instantly as being bone. You could see osteocytes living in the lacunae here. You could see osteoblasts along the edge of the spicule, and you could see marrow and fat, various types of marrow cells. You can also see that there's some type of lining here, perhaps the wall of the cyst. Here's another picture in which we can now clearly identify that these are sebaceous glands. They look like classical sebaceous glands. You can see a squamous lining here at the edge of the cyst, and you can see some type of connective tissue here, perhaps with the large blood vessel. Here's some smaller blood vessels. This is a benign dermoid cyst, and just to show you that it is a teratoma because it gives rise to both epithelial as well as connective tissue elements. Let's talk about the main things that malignant tumors do. Well, the first thing they do is they become malignant, and the process by which normal tissue or non-malignant cells under the influence of, let's call them carcinogens and other things, the process by which normal cells become malignant is referred to as transformation. The transformed malignant cells then grow. Okay, now the one thing that makes cancer cancer is that it has the capability of invading, in other words, destroying localized structures, including its neighbors. And from a microscopic point of view, the first sign of invasion would be, for example, if an epithelial malignancy or carcinoma broke through its basement membrane. That would be the first sign of invasion. The word invasion is totally synonymous with the word infiltration, and they're used interchangeably. The fourth thing that almost all malignancies characteristically do, classically, with enough time, is they metastasize. They can first metastasize locally to neighboring areas or lymph nodes, and then as time goes on, they can metastasize distantly to organs way far away from where they started. Another concept that we must deal with, again, we've dealt with this several times before, is the concept of differentiation. This is very, very crucially important. We talk about tumors as having a certain degree of differentiation, and sometimes they're given numbers, 1, 2, 3, 4, 5. Sometimes they're given Roman numerals, sometimes they're given letters, and we basically do whatever is trendy and politically correct for the generation. But it doesn't change the fact that there's basically 3 stages of differentiation. If cancerous or neoplastic tissue looks extremely close to the cells from which it originated, we call that a well degree of differentiation. And as you might guess, well differentiated neoplasms might be difficult to diagnose because they look so closely like the original normal tissue. If the tumor cells don't look at all like the cells that they originated from, or the tissue or the gland or the organ, then we call that a poor degree of differentiation. And this is misspelled, as you could see. So there would be no problem in diagnosing a tumor that was poorly differentiated as being malignant, but we might not be able to understand where it came from if it doesn't look like the cells that it's coming from. And there's basically a graded between well and poor, that's called medium or moderately well or moderately poor, depending on what kind of words the pathologist wants to use. But let's just say that there's well, there's moderate, and there's poor, depending on whether the tumor cells look a lot, a little, or not at all, like the tissue that originated from. Sometimes the word anaplastic is used referring to the general cancerous process itself. Sometimes it's a general adjective. Sometimes it's a specific classification for a tumor. Or sometimes it's used to show that tissue is not just dysplastic or potentially pre-malignant, but it's just downright malignant. That's why the word frank is often used in the literature before the word anaplastic, because it means downright malignant. Now, as you might guess, depending on how these cells look, these malignant cells, is going to predict how they behave. And it's not, you don't need a degree in rocket science to figure out that if cells look a lot like normal tissue, they're probably going to behave, or in other words, infiltrate or metastasize, less likely than cells that are poorly differentiated. Here's a really good example. You see these guys here? They look pretty bad, don't they? You could look at a bunch of guys like this in your neighborhood and say, you know what? These guys look pretty bad. I think they're going to behave bad as well. On the other hand, you may be walking down the street and see a bunch of guys like this. This is the Mormon Tabernacle Choir. They look pretty good, don't they? They look pretty angelic. They look pretty holy. You wouldn't expect them to rob a bank or start a street fight or steal your car, because they look good, so they're going to behave good. On the other hand, these guys don't look too good, so you're going to guess that they're going to behave bad. Let's take a theoretical tumor. This is a uterus here in the northeast corner. These little white nodules are balls of smooth muscle tumor arising from the smooth muscle of the wall of the uterus, which is called myometrium. So generally speaking, if a tissue rises from an area, the cells may look similar from which it arose. Now, if you took a low power view of this tumor, you might see a little whorled, perhaps encapsulated connection of cells. If you looked at it on really high power, and you would say, my God, these cells of this tumor look exactly like normal histologic smooth muscle. It must be either be a well-differentiated tumor or a totally benign tumor. And generally, benign tumors are extremely well differentiated. That's why they're benign. On the other hand, if you look in the southwest here, and you can see 1, 2, 3, 4, 5, 6 mitoses, big cells, dark cells, things we're going to define later, you're going to say, you know what, this doesn't look too good. I suspect this might not behave too good. Well, the fact is, these are muscle tumors, smooth muscle tumors arising in the smooth muscle area. And if they looked exactly like normal smooth muscle histologically, you could probably classify it as a benign leiomyoma. If, on the other hand, the cells microscopically looked like this, maybe a lot of mitotic figures, as well as other features we'll talk about, you might call it a leiomyosarcoma. And that is indeed the case. Let's talk about the concept of anaplasia now, as long as we open the doors. We talk about anaplasia as being synonymous with malignancy. The anaplastic features of tumors microscopically have several common features, which I just want to show to you quickly, and we'll talk about them in the next group. The two most commonly used words on pathology reports are pleomorphism and hyperchromasia, but they'll talk about nuclear cytoplasmic ratios, chromatin clumping, prominent nucleoli, mitoses, and loss of polarity. We're going to give you a lot of good, clear examples of that, so you'll always know the general microscopic features of any malignant or any anaplastic process. I thank you very much.